Hello there, I'm Dr. Ace, and today we are going to unravel the secrets of a common yet misunderstood condition, which is sciatica. Stay tuned as we explore not just what this pain means, but how you can alleviate it from the comfort of your home. Well, we will start with the first question that many of you might be making is, what is sciatica? Sciatica is essentially the pain that radiates along the path of the sciatic nerve, which branches from your lower back through the hips and buttocks and down your leg. Typically, sciatica affects only one side of your body and can manifest as a mild ache to a sharp or burning sensation, or even an excruciating discomfort. Some people may experience numbness, tingling, or muscle weakness in the affected leg or foot. You might wonder, why does this happen? Well, sciatica commonly occurs when a herniated disc, a bone spur on the spine, or a narrowing of the spine compresses part of this nerve. This compression causes inflammation, pain, and often numbness in the affected leg. Now, the types of sciatica are categorized mainly as mechanical and inflammatory. Mechanical sciatica might occur from physical compression of the nerve by either herniated discs or a bone spur. Inflammatory sciatica, on the other hand, results from internal body reactions like swelling due to injury or other conditions that might inflame the nerve's pathways. So what triggers this nagging pain, you might be asking? Well, it could stem from aging, obesity, prolonged sitting, diabetes, or a physically demanding job. But it's also something that might just flare up from your daily activities or even during pregnancy. Now, onto the part that most of you are eagerly waiting for, which is, how can we manage or treat sciatica? The first thing to understand is that while the pain might be severe, most people can manage their symptoms with non-operative treatments. This could mean that simple home remedies and exercises, if performed correctly, can heal you and make it so you don't feel pain anymore. Now, the first tip that I need to give you is keep moving. While resting for a day might help, prolonged inactivity will make your symptoms worse. And now, here are the exercises I promised you that will help sciatica. The first one is the basic seated stretch. You begin this stretch by sitting down on a chair and crossing your painful leg over the knee of your other leg. Then you follow these steps. You bend forward with your chest and try to hold your spine straight. As long as it's not painful, try to bend over a bit more and stop if you feel any pain. You keep this position for about 30 seconds and repeat the exercise with the other leg. There's also the seated glute stretch, which you can see right here. You sit on the floor or on a chair with your legs out in front of you. Then you bend your right leg, putting your right ankle on top of your left knee. Now you lean forward and allow your upper body to reach towards your thigh. You hold this position from 15 to 30 seconds. This will stretch the glutes and the lower back, and you repeat on the other side. Now we go into the standing hamstring stretch. This stretch can help ease pain and tightness in the hamstring caused by sciatica. First, you will place your right foot at or below your hip level on an elevated surface. This could be a chair, an ottoman, or a step on a staircase. You flex your foot so your toes and legs are straight, and if your knee tends to be hyperextended, you keep a slight bend in it to avoid hyperextension. Now, the second step, you bend your body forward slightly towards your foot, like you can see here. The further you go, the deeper the stretch. Don't push so far that you feel pain. You need to avoid pain doing these, okay? Now, the third step is release the hip of your raised leg downwards as opposed to lifting it up. If you need help easing your hip down, loop a yoga strap or a long exercise band over your right thigh and under your left foot. Now, the fourth step is hold for at least 30 seconds this position, and then you repeat on the other side, and you do it 3 to 4 times a day, okay? Now we're going into the next exercise, which is glute bridge. You lie on your back with your knees bent and feet flat on the floor. Hip width apart, allow your arms to rest straight on your sides with the palms down. Now, the second step is you tighten your core, drawing in your belly button towards your spine. The third step is you press your arms into the floor for support and push through the heels, raising your hips towards the ceiling and squeezing your glutes. The goal here is for your body to form a straight line from head to knees with very little arc in the lower back. You will hold this position from 5 to 30 seconds and then you will lower down slowly. This will be 1 rep, which means 1 repetition. Now, there is the knee to the opposite shoulder. The knee to opposite shoulder stretch is done while lying on your back. This simple stretch helps relieve sciatica pain by loosening your gluteal and piriformis muscles, which can become inflamed and press against the sciatic nerve. You lie on your back with your legs extended and your feet flexed upwards. The second step is you bend your right leg and clasp your hands around the knee. The third step is you gently pull your leg across your body towards your left shoulder, hold it there for 30 seconds, and then you remember to pull your knee only as far as it will comfortably go, okay? Don't force this. And then you should feel a relieving stretch on your muscles, and you'll feel no more pain, okay? The fourth step is push your knee so your leg returns to its original position, and then you need to repeat these steps for a total of 3 reps. Then you switch legs. There is also the figure 4 stretch. The figure 4 can help you open your hips, and there are multiple versions of this stretch, but for the purpose of relieving sciatic pain, you can do it by following these directions, okay? First, you lie flat on your back and then you bend both of your knees. Then you cross your right foot over your left side, moving your legs up towards the torso. Then you hold this position for a moment and then repeat all of this on the other side. It's important not to force the stretch, okay? Instead, allow gravity to bring your legs closer to your body more naturally, achieving a deeper stretch. There's also the clamshell stretch. When you lie on your back with both of your knees bent, tuck your bottom arm under the head to support it, and then you engage your core, drawing in your belly button towards your spine. Then you keep your feet together and slowly raise your top knee, opening your legs like a clamshell. You use the top arm to help steady yourself so you don't roll towards the back, and then you hold 5 to 30 seconds and you can lower down slowly. This will be 1 rep. You can do 3 reps for each side. There is also the Cobra Stretch, where you lie on your stomach with your hands under your shoulders and your elbows tucked close to your body. You inhale as you press your palms, slowly extending your arms as you lift your head, chest, and shoulders. You keep your eyeballs slightly bent and your chin lifted up all the time. You tighten your muscles in your core, which is the abs and back, and your thighs. You hold it for 30 seconds and then you lower down slowly. This will be 1 rep. Now, if you found this video enlightening and helpful, please hit that like button and subscribe if you haven't already. Your like can help save lives by spreading the word and providing people you care about with the tools to transform their lives too. Thank you so much for watching. Drop a comment below and share your thoughts and your own experiences with these methods. Stay motivated and I see you in the next video. Bye bye.